Good morning. My name is Nomandem Mbambo. I'm the clinical director responsible for internal medicine and psychiatry. I'm responsible for supporting our clinicians in the facility in the hospital to facilitate ensuring that we provide quality clinical healthcare services in the hospital. And one of our key major priorities as the Department of Health is an improved patient experience of care. And mental health is a very critical component of that. In the month of March, we recently celebrated or rather commemorated mental health care our awareness, and the theme for this year's mental health day was mental health care as a universal right. So the opening of this ward is a fulfillment of that. We are very excited as the Gauteng Department of Health and Hani Baragwanath Hospital Academic to be opening a new admission ward that came about in 2020 when we had a challenge of COVID-19, and we realized that as an institution we did not have a dedicated facility to admit patients that were infected with COVID and had mental health care challenges. So the department, when they were approached by the Islamic Relief Foundation of South Africa of what is it that we would like to do, the management of Hani Baragwanath requested that then we build a facility that will be able to accommodate our mental health care users in a dignified manner.
We're here today at the inauguration of the new admissions ward for psychiatric patients at the Hani Baragwanath Academic Hospital. It gives me really immense pleasure to be here today, to witness the culmination of a project which started 13 months ago in October of 2022. Today we are here after having invested 3.6 million rand in upgrading the facility. We have built and renovated a facility that is really something that all of us should be proud of.
I am Dr. Mvuiso Talatala. I'm the head of Department of Psychiatry here at Hani Baragwanath. Hani Baragwanath being one of the biggest hospitals in the Southern Hemisphere, and our acute unit is one of the biggest in the country. Today we are actually blessed because we are opening this beautiful ward which we're going to use as an admissions ward. It's a 20-bed ward. We're going to use it to look after patients that get sent to Hani Baragwanath for assessment and treatment. Just to give you the background, we have been having problems in that patients come to our casualty department and they get assessed and they found that they need to be admitted by a psychiatrist, but at times there are no beds. They end up lying on stretchers for hours or sometimes even days. So this ward is going to intervene in that space, because what we're going to do with this ward, as you can see, these are the doors to the actual cubicles of the ward. We're going to move the patients from our casualty department here at Hani Baragwanath, bring them here so that we can do a 24 to 72 hour assessment. Those we treat in that 24 to 72 hour period, we send them home. And those who need further stay in the hospital, we then send them to the ward. This is quite important for the community of Soweto and for the community of south of Johannesburg, because Hani Baragwanath is the head of the cluster that covers Soweto, Vereeniging, all the way to Vosloorus and all the way to the west. So we cover a big area with a big demand for mental health care services. So this ward is going to enter that space of reducing the time spent by the patient at casualties. I think it's actually a unique offering in the whole country. I don't think any of the acute units have an admission ward. So we enter into that space. And it's a space that will also assess substances, because sometimes patients come to the hospital intoxicated or withdrawing from substances, and you would think that substances, drugs, you would think that they are mental health care users that need long-term treatment. And you find that if we can stabilize them, we'll maintain their dignity, stabilize them and discharge them, and then we can refer them to social services for the substance-related problems.
Good afternoon. I'm Dr. Selepe, the Acting Chief Executive Officer of Hani Baragwanath Academic Hospital. Today we are opening an admission ward for our mental health care patients. It will house both male and female patients. So we are really happy and joyful for this donation or this assistance that comes from the Islamic Relief Fund. As a hospital, and we were pressured with our patients that are admitted in our accident and emergency unit, and they would spend a couple of hours whilst waiting to be admitted in the respective psychiatric or mental health care users wards. So this ward is going to assist us as a hospital to reduce that waiting time in our accident and emergency. And it will also be providing a safe environment for these patients which are vulnerable, rather than them spending a couple of hours in an environment that is unsafe. Now they'll be kept, or they will quickly be moved to a safe, comfortable place which meets all the standards, or that meets all the ideal standards set out by our policy for mental health care users or psychiatric patients. So we are grateful for this fund from the Islamic Relief Organization to partner with us as Chris Hani Baragwanath Hospital. That really has gone a milestone for us. Thank you.
My name is Noman Tunko Morali Huku, MEC for Health and Wellness in Gauteng. We are here today at Chris Hani Baragwanath Academic Hospital, and together with Islamic Relief South Africa, we want to thank them for the good work that they've done, because they've renovated this beautiful ward that you can see for us, which is 21 bedded, which is going to accommodate our acute mental health care patients. It's really a privilege for us to have relationships with people like Islamic Relief South Africa, because they are doing wonderful work in our communities. But besides, they are working with us even in other communities. With like in Leratong, they are doing cataratic surgeries. So much work that they've been doing in assisting this government of ours, and we do appreciate this government, because we need people like them. That's why we're making a call to every South African, if they can do what Islamic Relief South Africa is doing, of assisting us as government, because in government we need more stakeholders that must assist, especially in building or renovating facilities for us. But this is the beautiful facility, as you can see even yourself, that will help us in this acute mental health care problem that we are having in the country and in the province.
There have been lots of ups and downs,
Right.
but I'd like to say thank you to Islamic Relief that they stood by us, and even though I think there were 2 or 3 times when the project almost fell apart, but
We've seen it through.
Shukr, thanks to Islamic Relief that we saw it through, and we are really, really grateful for what we have here now.
Thank you so much to Prof. Shin. As you can see, this project, it was conceptualized some time ago, but we are so proud to be here today to see this amazing facility. I just came through here with one of the doctors a few minutes ago, and she said, wow, she can't believe it, because she's working in the main hospital, and I mean, you know what the facilities are like. And as you know, it's most often that patients who suffer from mental or psychiatric illnesses, they get the short end of the stick, even when it comes to the limited facilities that are available. So we are extremely happy to have been part of this journey and to see it culminate in this amazing facility. I walked through myself, everything looks just so amazing, and we hope that this is also, it's part of a legacy that we leave behind. And it's not just in the bricks and mortar, but actually the people and the lives that will be touched by the treatment that will be administered in this facility. For us, and we pray whoever contributed towards this venture, that Allah subhanahu wa ta'ala bless them, and it be counted on their scale of good deeds and ongoing charity for them, inshallah. Ameen.
Ameen.